So let's see actually
Okay.
how many join.
All right.
People have expressed interest.
All right.
Even Goa we have sent. Just check with them also.
Okay. Okay.
Yeah.
So I have my colleagues here, Kanika Oberoi and Vivek
Yeah.
Tripathi, and they'll be sort of looking at. So Kanika Kanika, I will request you to keep a tab on, how many students we have or participants we have in the session today. I will also have another colleague, Shomik, joining. Kanika, do we have any confirmation from Shomik so far?
Yes, we did. I'll just connect with him again.
All right. Okay.
I'll just let you know.
So,
Yeah.
fine. So while we are and all these students are PG students, ma'am?
Yeah, most of them are resident doctors. I have also asked to share on HR groups, but mostly they will be resident doctors.
So they're doing their MD or MS.
Yeah, MD community medicine.
All MD community medicine. Okay.
Yes. Now this Shubham Regi, you can see now. So there, all the PG students from our side are sitting in the classroom, and they have displayed it on a TV board.
Okay, one common. Okay,
Yeah,
they've connected
same thing will happen in
common.
KM also. So many of the people, they have a big TV, 52 inches or something, and then they sit in a classroom and then they listen.
Got it. All right,
Yeah.
that's fine. Thank you.
Yeah.
Mrs. Shomik is joining in a minute.
Yeah.
Sure. Thanks, Kanika.
Yeah. Let's KM join.
I think we can start the webinar in another minute or so. Mrs. Shomik and Dr. Preeti are here.
All right. Yeah.
I request everyone to keep themselves on mute.
Yeah. Thank you, Dr. Preeti and Dr. Shomik, to be available for this webinar. I think it will really help our postgraduate students. Some of them are still joining. I think Upar is joining. I think we can start and they will keep joining. Chinu has joined. Okay.
Good afternoon, everyone. We welcome you all to this webinar on role of public health and various career opportunities. We have with us Dr. Preeti Negandhi and Mr. Shomik Ray, who will be conducting this webinar. Thanks again for joining, and over to you, Dr. Preeti. Thank you.
Thank you, Kanika, and very good afternoon to colleagues from colleges across Maharashtra. Kanika, I just want to confirm I'm audible.
Yes.
Yeah, thank you so much. So I would like to share, first of all, that I am also from Maharashtra. I have graduated, I did my MBBS from Mumbai, from D.Y. Patil Medical College, and I did my post-graduation in PSM from Nagpur, GMC Nagpur. So I feel very happy to be interacting with all of you. And, after I completed my MD PSM, I did my MSc in Public Health Research from University of Edinburgh, just to get some additional skills and knowledge related to public health. And here I am at Public Health Foundation of India. I work here as a faculty, and I teach epidemiology, research methodology, disease surveillance, health information systems, and a little bit of basic biostatistics. So just like, you have your faculty in your medical colleges, similarly, I'm a faculty here. We are based out of Delhi. Although all of you are already doing your preventive social medicine or community medicine from your respective colleges, I want to talk to you today a little about what is the role of public health in India and how relevant it is in terms of addressing all the health challenges that we have across India. And I have a colleague with me, Mr. Shomik Ray. He's also a faculty at our institute, which is the Indian Institute of Public Health, Delhi. And he will talk to you about the career opportunities, because now you're all postgraduate students. After this, you may have questions as to what you can possibly do with the degree that you have in the public health space. So he will talk to you about the possible career opportunities. So I'll just put up my slides. Give me a minute to share my slide deck with you. And Kanika, please confirm when you can see my slide.
Yes, it's visible. You can
It's
probably
visible?
put it on the slideshow.
Yeah, I'll do that. I'll do that. Is it visible now?
Yes, yes.
Yes.
Yeah, thank you so much. So I will not take too much of your time because you'll know all of this, but I just want to sort of highlight the importance of public health in today's Indian health scenario. You all are already aware about this definition of public health, which is the WHO definition that we've all learned even when we were doing MBBS. Now, as a PG student also, I'm sure this is something you come across very often.
And then we'll see this together.
Health is all organized measures, public or private, to prevent disease, promote health, and prolong life. And we're not working one-to-one with a patient, with a single patient and a single clinician or a single doctor, but here we're looking at a population as a whole. So I'm sure all of you always keep thinking about how we can affect population health rather than just affecting or improving the health of one individual or one group of individuals, right? So that's what essentially public health is all about. I just quickly want to give you a glimpse of, it'll only be a glimpse because it's very difficult in a 15-20 minute session to cover all the possible health challenges, but some of the core challenges that India is facing today, and this is something that it has been facing for the last so many decades now, is the communicable disease burden. I'm sure all of you all must be reading about this when you're, you have your PG presentations. Some of you are doing your dissertations. Your faculty is talking to you about it, and I'm sure you all are seeing this in your clinical, when you go for your you go to the UHC and your rural postings and all of that. TB is something which is a scourge we have not been able to tackle. We should have been able to tackle it by now. We have not yet been able to tackle it as much as we should have, right? Now, this data that you see on the slide is the data from the latest NFHS round of 2019-21. It says the TB among persons more than 15 years is at the rate of 316 per lakh population. So you can imagine, and this is only one form of TB, right? We are not looking at other forms of TB, the extrapulmonary, etc., etc. TB, a lot has been done, a lot of research has been done, a lot of, there's been a lot of treatment in terms of the treatment, in terms of the health program, a lot of work has been done on this, but we are still not able to, somehow combat this disease. It's been so many decades now that we've not been able to do it, right? So this is something which has stayed with us all these years. Especially post-COVID, the prevalence seems to have gone up, probably because it got neglected or probably because there were some secondary infections after COVID or things got complicated because of COVID. I mean, there could be multiple factors related to that, but post-COVID, so post around 21 or 22, we have seen a surge in the number of TB cases. And, it's just not getting eliminated. We're just not able to fight it as much as we should have. To add to that burden, which has been existing with us, we have this burden of non-communicable diseases. I'm sure all of you are aware of this. It's nothing new. We are looking at diabetes, we're looking at pre-diabetes. Look at the numbers here. We have 136 million pre-diabetic people in India. We have 101 million frank diabetes people in India. This is an ICMR study that was done very recently, and these numbers have come from there. Now, where are we going with these numbers? Where are we going as a country with these numbers? Is this going to take care? Sorry, can you take care of this by looking at the patient and saying, oh, please have these anti-diabetic drugs or insulin or metformin or whatever it is that is given to them and say ki theek hai, humne diabetes ko theek kar diya. It's not just about the treatment part of it. No, there are lots of other factors which need to be tackled if we're going to bring these numbers down to a level where, as we say it so often, level where it ceases to become a public health problem, right? So this problem is, and it's not just diabetes, you have cancers, you have hypertension, you have stroke, and cancers are, again, it's just a whole big gamut of, diseases, your breast cancer, you have young girls in their 20s coming up with breast cancer. diagnosis. And of course, cervical cancer, then there's oral cancer, then there's, your other cancers. So we are not, we say our health system has improved a lot. There's a lot of good things that have been done in terms of medical advances, pharmaceuticals, technology. There's a lot of advancement, agreed. But there is still scope for more. We are not where we should have been or we could have been after all these years of the advancement that we are talking about in the medical field, in medical science. The third part of the burden is our emerging and re-emerging infections. And the classic example that we can talk of today is the COVID episode that we've had in the recent past, right? The numbers are skyrocketed. Again, there is a resurgence of COVID infections. I'm sure all of you are aware of this. Nipah, there have been outbreaks. There have been at least 6 outbreaks in India of Nipah infection in the recent past. You must have heard about a recent one in September. There was an outbreak in Kerala.
Nipah virus.
Yes, Nipah. So my point is, these things keep sort of making it very challenging for the health system to go beyond what we used to see, say, 30 years ago or 50 years ago. Of course, things have improved. Nobody's saying things were exactly the same as they were or as bad as they were. Things have improved. But we should have been much better than where we are today with these numbers. Hopefully, in the coming years, we'll get better. But there are climatic changes that are happening. There's a lot of lifestyle factors that are involved. There is, I'm sure you all are aware of what's called as the epidemiological transition. There is a nutrition transition. There are so many different factors playing their role at the same time in the way we are leading our lives, the nutrition we are exposed to, the the kind of stress we are exposed to, mental health. Who talked about depression, say 20 years ago or 15 years ago? Depression, people had depression even then. But the diagnosis of depression was far and few in between, right? But today, every second person is depressed. Every second person is taking anti-anxiety pills. Every third person is having some or the other stress. Ophthalmic, problems, your visual acuity problems because of COVID, when the students of school-going age were at home, they were with the laptop and with the mobiles the whole day because of online schooling. And every child who is currently in school, not every child, but I mean almost every child is, she uses spectacles. And they have problems because of they're so used to viewing the laptop, they're so used to viewing a mobile screen. We never did that when we were kids. We never had to, actually. They were sort of forced into doing it. It's not their fault. But my point is, these are, health related issues which have come up in the recent past. They never existed. There were some like TB that existed and that still exists. And there are newer problems that have been added like diabetes and your other non-communicable diseases, cancers, etc. And the third part is these new emerging and re-emerging infections. So this triple burden is sort of making our health system, that the challenges are sort of, threefold. And then it's not only at a clinical level that this can be taken care of. That is where public health comes in. That's what I'm trying to sort of highlight here. That, there are these problems which you can't just tackle by sitting in a clinic. I'm not undermining the, the importance of a clinician here, but thank you, Dr. Rujuta. As I said, I'm not undermining the role of clinicians here. Of course, they play a very crucial and a very, very important, very central role in our health systems. And we need them just like we need our other doctors. But at a population level, if you want to understand what you can do to prevent people from falling sick, to prevent people from, let's say, having cancer or diabetes or hypertension, that needs to be done by public health people, right? I'll also quickly talk about maternal mortality ratio and infant mortality rate, something that I'm sure all of you all have been reading about. Where were we, let's say around, some, even about as early as recently as about 5-7 years ago. we were at 120, 130 per 100,000 live births. Today, we are down to 97. So, of course, kudos to the health system across the country, right? But 97 is a national average. If I have to then disaggregate it state-wise, you'll realize that, some states are doing very well, like the Kerala, Tamil Nadu, even Maharashtra to some extent is okay. But then there are states where the maternal mortality ratio is still alarming. And I'm sure all of you again are aware of the SDG target of 2030. We have to reach a target of 70. That is a target that has been set. Do you think, given the current interventions in the program, we will be able to achieve the target of 70 as a country? And it's not only country is a national average, right? So it will sort of average it out also. But when I say country, it doesn't mean a Rajasthan and a Kerala are performing in the same way. There will be differences, right? Or a Maharashtra and a Karnataka may not, perform in the same way. Even within Maharashtra, I'm sure every district will have its own problems or its own challenges and its own factors that lead to the way our outcomes are presented. Same is the case with infant mortality rate. We have done a fantastic job at bringing it down to a good 28 per 1,000 live births. But, we wish it could be even lesser. And let's hope that it is lesser in the coming years. As I told you, this is the figures. And then we have another major problem, especially among women in the pregnant age group, under 5 children, and the reproductive age group. Look at the numbers, 52%. I'm sure all of you have read this when you came across the NFHS 5 report. The latest report of 2019-21 states that anemia prevalence is 52.2%. For under 5 children, it is 68%. That means out of every 10 children under the age of 5 years, 7 children or 6 children are having anemia. If a children who is not even 5 years old is anemic today, and especially if it's a girl child, can you imagine what will be the state when she's, say, 20? By the time she's 20, 25 years old of marriageable age. And then she has to have children, and then she has to, bring up a family. So it's the implications of all this is huge. And we're not talking here about one child or one female or one this. It's just, we're talking about the population as a whole. So think in terms of the numbers. 52% of Indian pregnant women are anemic, or 68% of the under 5 children across India are anemic. That's millions of children. All right. Similarly, nutrition. We have 35% stunting, 19% wasting, and 32% underweight. So almost 1 in 3 children are underweight. On one hand, we're talking about obesity, and we're talking about tackling obesity and where are we going with this obesity and diabetes and hypertension, as a complication, long-term complication of that. And on one hand, we are talking about underweight and stunting and wasting. Again, I don't need to go into the details of this. You guys know this very well. We have this whole, extreme, the whole long, wide spectrum. And then, at the 2 extremes are undernourished children and the obese children, or even adults for that matter. Because a child who is underweight, severely underweight, you've heard about SAM and MAM children, severely acute malnourished and moderately acute malnourished. If somebody is severely acute malnourished, wo hatta katta ban hi nahi paega na by the time he or she grows up to be an adult, a young adult. So at the beginning itself, if you're not taking care of nutrition, what kind of life, in terms of cognitive, in terms of even physical for that matter, physically, how fit do you think that child would be? Or mentally, how fit do you think that child would be for the rest of his life? So this is just to sort of, set the scene to let you know where we are with respect to our health problems. And I have only given you a glimpse. This is only the tip of the iceberg. There are many other problems I've not talked about. I've not talked about environmental challenges. I've not talked about mental health problems. I've not talked about, talked about many of the other, let's say, health expenditure related issues. That is also a health system issue here. So out-of-pocket expenditure, for example. I'm not talked about those things, but I'm sure now you understand where we are in terms of the public health scenario in India. And this is where you guys come in. We all come in as public health professionals. This is where we can make a difference as a group. So what I'm trying to say here is that public health is a wise investment because we are the ones. I know it's difficult. It's very easy for a cardiologist to say, you know, I treat heart problems, or for an ophthalmologist to say, I treat eye-related problems. Because somebody, a lay person can understand that. A lay person can relate with, oh, I have glaucoma and an ophthalmologist will, you know, treat my glaucoma, or I have a certain infection, a physician will give me antibiotics and treat that infection. It's very easy to relate to that sort of a medical problem. But when I go and tell people I'm a public health professional, so they say, exactly what do you do? And I say, I'm a doctor. They say, yeah, but you're a public health doctor. So what is your job? So I say, I tell people how not to fall sick. So like, what is your job then? If anyway somebody is not falling sick, then we don't need you. You're getting my point. So it's sort of, you know, contradictory in that sense. Public health helps us to save money. Public health helps us to promote health. Public health helps us to enjoy good health and good physical health, good mental health, good emotional health, good spiritual health. It helps us to live longer with good quality. Do you all agree? But this is something which is very difficult to explain to a layperson. You and I understand this when we come, and what we have been learning, we understand how public health becomes a wise investment. Now, we are all aware of the different programs. Again, there's a long laundry list of programs that are being implemented on the ground level across India. You've all heard about the Ayushman Bharat program, the Swachh Bharat program. We have for TB, we have the National Tuberculosis Elimination Program. For vector-borne diseases, we have one. We have programs for all the diseases. Mental health also, there is one program. There is a program for our non-communicable diseases also, diabetes, cancers. Programs are there for everything. But are we really reaching the last mile as a result of the implementation of the programs? What is the status of the monitoring of those programs? Who is going to do the evaluation of those programs to see whether they need any changes, to see whether you need to expand them further, or maybe even, just put a stop to the program, saying, oh, now everything is fine. We don't need people here. We don't need to spend money on this. Because every program, to run it, you're going to need a lot of resources in terms of manpower, in terms of funds, in terms of infrastructure, etc. So you have to be able to justify for every program, why do we need to continue this? So somebody has to monitor it, somebody has to evaluate it time and again to be able to tell that this program is really needed, or maybe even start a new program for that matter. You're going to need evidence. You're going to need data. You're going to need that backup to tell you what to do, to tell the policymakers what to do. So for the running of these programs, for the monitoring of these programs, for the planning of these programs, for planning of new health programs, for deciding how to identify which program needs more resources, how to rationalize the currently available resources, to gather the evidence to even make that decision in the first place through public health research. For all this, we need trained individuals who know what public health is. And that is what you people do. You people are currently being trained to become public health professionals. You are already trained to some extent, and you are being trained further to become public health experts or expert professionals, where now one of you might say, oh, I like NCD better. The other person might say, I like health economics better. The third person might be interested in environmental health. The fourth person may be interested in something else, which is fine. But the basic public health professional in you is looking to serve not only a small group of individuals, but to serve the population as a whole and make a difference to the health system at a population level rather than at an individual level. This is where we come in. So I'll tell you quickly about what we do at the Public Health Foundation of India. This is a an autonomous public-private initiative which was launched by the then Honorable Prime Minister Dr. Manmohan Singh. PHFI was launched in 2006 at New Delhi, and the whole mandate, the idea with which it was launched was that we wanted to strengthen the public health system in India by building public health institutional capacities. For all the problems that I've been talking about over the last almost 10 minutes, you realize that you need people who are trained, who have the analytical skills, who have epidemiological skills, who have research skills, who have data collection skills, who have skills to evaluate, to monitor programs, to evaluate, to even think about how to implement programs, how to run, for example, a clinical trial, and come up with data which will act as evidence for decision making, not only for public health professionals but also for clinicians. So we need those people. So we decided, PHFI was born with the idea, with the vision that we'll create these public health professionals who can actually make a difference in this way at a population level. Recently, our parent organization, the Public Health Foundation of India, of which we are an academic institute, has been ranked second in the global rankings for schools of public health. This was an article which was published in the International Journal of Public Health. And one of the co-authors of this article is Margaret Chan, who has been the DG of WHO in the past. So this is another feather to, which has been added in our cap. And I just wanted to highlight this, the fact that we have been globally sort of recognized for the work that we do. So what do we do? We aim to prevent disease, promote health, set benchmark standards in public health education. So our forte, if you ask us, is public health education. Our forte is academics, public health related academics, training, capacity building, and of course, research. We work with these groups. A lot of our work is done in collaboration with the Ministry of Health and Family Welfare at the central level as well as at the state level. We are working also with a lot of civil society organizations, academia globally, and of course within India, and industry leaders, because nowadays there's a lot of CSR interest in public health as well. These areas that I've mentioned on the slide is just a glimpse of what we do. Our work is not limited to these 12 thematic areas, but by and large, our teams at PHFI are working in one of these areas. And then, of course, there are many other people who are doing research on public health areas or related areas which are beyond the list that is mentioned here. So we have a good maternal and child health portfolio, a team working on mental health, a team working on nutrition, disabilities, injuries, sanitation, environmental health, infectious diseases, NCDs, etc. And as I said, our core work or our core activities include our academic programs. We run the MPH program, which is our Master of Public Health program. I'll come to that in a slide or two. Our MSc in clinical research, we have PhD programs as well. We have the postgraduate diploma in public health management as well. So these are just, some of the programs that we run across, just like how you are having your MD for a period of 3 years. Similarly, we have these programs because it's not like a medical postgraduate degree. It's not a 3-year program, but we have 1- and 2-year programs. And then, of course, we are into training, these short-term trainings. So somebody says, I want to learn how to work on Stata, or I want to learn how to work on SPSS. We say, why not? Come for a week, learn how to use Stata. We'll teach you how to use the software, and you can go back with the skill. We do not promise that you will become an expert on the 5th day, but at least you will now not be a zero in Stata. You will at least know how to use the software, how to browse the software, how to explore the software. And then our 3rd and 4th pillars of activities are, of course, our research and technical support and health systems innovation. So various teams within PHFI are working in various areas where they are involved in research in the field or secondary research, or they are partnering with some university abroad, or they are working with the government. A lot of our work is closely done with the government, as I said, central and state government both. I've already given you an idea about our programs, but just to again recapitulate, we have our on-campus programs, which are our full-time master's and postgraduate diploma programs. We also have our e-learning programs. We have a very, very strong portfolio of online programs because, people like you, when you are, let's say, doing your MD, it's not possible for you to come down to Delhi and, engage in one of our on-campus programs. But you may be interested in, let's say, doing a specific program on epidemiology or nutrition, for example, public health nutrition, or maybe M&E or health promotion. So we have these different clinical research methods. We have a good portfolio of e-learning programs. We have a portal that we at PHFI are using to offer these programs, and you can, wherever you are in Maharashtra, Mumbai, Pune, Nagpur, wherever you are, you can actually you can enroll into the program while you are doing your MD, and at the same time learn this. You'll get a certificate. You have to study, of course, because at the end of the day, it's an academic program. But once you've completed that duration of the course, you get a certificate, an online certificate. And that sort of adds value because over those 6 months or 4 months, or some programs as we have are 12 months also, during that course of the program that you've enrolled for, it sort of gives you that edge. So you're learning about it anyways when you're doing MD, but it's just one of the many topics that you're learning. But here, when you do a focused e-learning program, let's say on public health nutrition, or on epidemiology, or on research methods, or on medical writing, your focus or your specialization in that area will get enhanced. So in that sense, it's very useful. And then, as I said, we also have a few PhD students who are affiliated with us, and they are doing their own work. They are doing their own research. I told you earlier that we are IIPH Delhi, and we are an academic institute under the parent organization that is PHFI. But we have other institutes within India, one at Gandhinagar, then one at Bangalore, one at Hyderabad, one at Bhubaneswar, and one at Shillong. So the similar courses that I'm telling you about that are being run at IIPH Delhi, similar courses are being run at these other IIPHs as well. Some courses are different. Okay, so for example, if you see in Gandhinagar, they're offering the Masters in Hospital Administration as well, which we do not offer at our institute, but the IIPH Gandhinagar, which is our sister institute, they are offering it. Okay, or for example, in Hyderabad, they have the integrated MSc and PhD in health informatics. So these are all specialized courses that are being offered at these various other institutes, which are also part of PHFI. So I was talking about this Master of Public Health program, which is a two-year full-time program that we offer jointly along with the Academy for Scientific and Innovative Research, which is ACSIR. It's a national, it's an institute of national importance, which has been recognized by an Act of Parliament. And you guys as MBBS doctors or as MD doctors are certainly eligible to do an MPH, but we do not restrict this program, or for that matter, public health is not restricted only to the medical graduates. So even somebody who has done their dentistry or nursing or pharmacy or physiotherapy or Ayush, let's say, an Ayurveda bachelor or a homeopathy, doctor, they can also apply for an MPH degree. Similarly, we have people from the non-health background, also somebody who comes from a management background or an economics background or a biotechnology background, a statistics background, anthropology background. They're also eligible to do an MPH degree. The current batch is going to clear their exams and pass out in the month of July. And from August, we are starting our next batch, which will basically be another 2 years from August 2024. And the admissions for that are open now. Our last date for applying for that batch, which will begin in August 2024, is 31st of May. The other program that we have is the postgraduate diploma in public health management. Now, this is a program that we have been running since 2008, and this has been supported by the National Health Mission, which is part of the Ministry of Health and Family Welfare. And again, here we are not restricting our enrollments to medical graduates, but any other health science, dental, Ayush, veterinary, nursing, pharmacy, life sciences, biotechnology, they're all eligible to take up this. This is the public, because it is about public health management. This particular course it's a 1-year course only, unlike the MPH, which is 2 years. This particular course is, the launch of this course was done with the idea that medical officers who are working within the public health system, or even nursing staff that is working within the public health system, they are expected to manage public health, manage various programs, manage their entire PHC, and a lot of administrative or management related work that they do, but that has never been officially taught to them. We don't learn public health management when we are doing our MD or even MBBS for that matter. It's a separate subject. Okay, we learn it on the side, but it's not something which is, for example, financial management, for example, inventory, or logistics, chain supply management. So these are things which are all taught in this particular program. And the whole idea was, because that is why National Health Mission has been supporting this program. And that's what we've been offering since almost 2008 now. So it's been a good 13, 14 years that we've been offering. So a lot of nominations we receive for this program from various states. Medical officers are actually given leave for a good 1 year. They come to Gurgaon, they study with us, they graduate, they give their exams and go back. And a lot of them have gone back, have received promotions, have been, given increments, and their course has been recognized, their degree has been recognized. So it has been really helpful for them. The third program that we offer is a very niche program. It's called the Integrated MSc in Clinical Research, followed by a PhD. So when I say integrated, basically what this is that you do a 2 years MSc in clinical research, you enroll for that program. And if you get a certain grade point average, your final GPA, if that is above a certain cutoff, then you are eligible to enroll into a PhD. But then it's optional. PhD is optional. You don't have to do a PhD, but there is an option. And here again, the enrollment qualifications are almost the same as that for an MPH. But the advantage or the difference between this course and the MPH course is that here you have a lot of scope to learn about clinical trials, how to conduct the trials, there are regulatory affairs related to trials, pharmacovigilance, drug development, and then the systematic reviews, there's economic evaluation of, data related to trials and stuff. So a lot of that is covered within this course. And that's why I said it's a very niche course, something which is very specifically, people who take up this course have very specific skills, and they can really make a lot of difference in, let's say, clinical trials related research, in the future. How our programs are different from programs elsewhere is that our curriculum is competency driven. We are, multidisciplinary faculty lot that you will find. We have our own experience. We have our own areas of expertise and interest. We not only dabble in academics, but we're also doing research at the same time. So we sort of bring that experience also with us into our classrooms. And so we are able to link our academics with our public health practice. A lot of our programs and our academics are based on problem solving, case building. We have a lot of case studies that we discuss. We use innovative pedagogy. because nowadays without innovative pedagogy, it becomes very monotonous. So we try and see, we have flipped classrooms, we have role plays, we have group, discussions, presentations. So we keep the students engaged in one way or the other all the time. Our focus is on transformative learning. And for our e-learning programs, we have our own learning management system, which I talked about. And so generally, we try and give our students an enriching virtual classroom experience. Even on campus, we try and make sure that we have a very lively and vibrant on-campus atmosphere. And a lot of our learning is self-paced. So in that sense, we think that we make a difference in the lives of our students as well. The students that we generally have are from the backgrounds that you see here. A lot of our students have been coming from dentistry backgrounds, nursing, medical, nutrition backgrounds, statistics, pharmacy, biochemistry, etc. And this is, if you see the link where you can actually apply. As I said earlier, 31st May is the last date for submitting applications for these courses. So if you are interested or anybody you know is interested, maybe in your family, your relatives, etc., please spread the word and let them know that we are, we are open to receive applications till the 31st of May. And we'll be more than happy to answer any more questions that you may have related to this. It's not just about sending the application form, but it's also the latest CV that will be required, the contact details of 3 referees, certificates, credentials, your qualifications, etc., and a 200-word SOP. That's what we ask for along with the application. Once we receive the applications, what we do is that we shortlist them based on the criteria, because those need to be fulfilled. Those are ACSIR requirements. And then that's followed by an interview. So the shortlisted candidates have to go through an interview, and final decision is communicated by end of July or early August. And as I said earlier, the course commences in August. So we have a 2-year cycle which begins in August every year. Let's say this is, these are some of the photographs. These are our students. Some of them are our ex-students now. Some of them are now working with us. So they studied with us, they passed out from our institute, and now they decided to stay back. So they're kind of working with us, or some of them are doing their PhD with us. And the photograph that you see here on top is one of our training programs, our short-term training programs. So we have a very vibrant on-campus life. And we would welcome you if you ever come down to Delhi. Do come and visit our institute, and we'd be happy to interact with you in person as well. This is the list of our on-campus programs. I talked about them very briefly early, but you can find this information on our website as well. As you can see that the PGDPHM program, which is our public health diploma program, is something which is being offered by most of our academic institutes. Also, the MPH program is something that we all offer. And then there are these specific programs that are being offered only at 1 or 2 of the Indian Institutes of Public Health. This is the list of our e-learning programs. I told you that we have a very large portfolio. The ones on the left-hand side are the 1-year courses. So they are the longer programs, the more detailed ones. But if you really want to go for 3 months, 4 months, or 6-month programs, then you have this list on the right-hand side in blue, wherein you can learn specifically about things like research methodology, monitoring and evaluation, public health surveillance, tobacco control, or clinical research methods, or nutrition, or career development in public health. Just to give you examples of the kind of programs that we offer. These are the numbers. You can write to us, you can give us a call. You can probably, Dr. Rujuta would be able to give you our numbers as well. If you have any queries, if you think you want to share these numbers with other interested candidates, I will be more than happy to share these with you as well. Thank you very much. And Kanika, over to you. If there are any questions, I'll be happy to take them, or maybe we want to do them later on. That's also fine. Thank you.
Yeah, maybe we can take the questions towards the end.
Okay.
Thank you so much, Dr. Preeti. Now we can request Mr. Shomik sir to present his slides or probably have a discussion with the participants.
Good afternoon. I don't think any slides are necessary because I'm also aware of the time. So I would rather take any questions if there are any. There's nothing more that I would want to add to it. So probably we are already towards the end of it. So let's take some questions if there are any and then close this probably. It's better that way. I wouldn't add any more slides into this.
Shamik, I think we say that most of our residents, when they complete their MD, we say that we think sometimes that they may be just a skill away from their dream jobs. So I thought that probably that gap could be filled with this kind of seminar or webinar, and that was my whole purpose of having this whole exercise. So they have got some information about various courses.
Right.
But what like when they enter into their career, so probably they may have some questions to ask. Like I don't know. Today's world, most of the postgraduates, they when they meet me, they say they want work-life balance, and sometimes they are hesitant because they think that teaching jobs are only the time-bound jobs, and what kind of careers they have when they actually get into global health careers. They are really not aware. So if you can share some insight into that aspect, and also how to get into those jobs, means how to find out these opportunities so that they can apply at right places, and whatever they are dreaming at or looking for, how do they reach their destinations? So if you could guide them about how to get these opportunities, and what is the life in you when you join this kind of job. So I think it will help them.
Okay. So I think to make it, put it in a structure, so I'll give you my background. So I'm not a doctor by profession, as Preeti had mentioned earlier. So I'm a management professional and working in public health. So I completed my MBA and then went and did my MPH from Johns Hopkins and then my MPhil from Newcastle University. So I have a completely different trajectory into public health than what many of you would have. But having been in the sector for now 25 years, I'm aware of the type of pathways that you would be following. Now, or you might be following. If I want to put it in a structure, if you see, there are some core functions of public health, right? And it's almost like a cycle or a triangle, if you might say so. It starts with an assessment, right? And moves on to policy development, and finally into assurance. So assessment of what is needed, what are the public health problems, what are the possible solutions. That's about assessment. Policy development is about creating the right policies out of the assessment that one has made. And the assurance is about providing the services, implementing or executing those policies on the ground. All of these are the three core functions of public health. Now, as public health professionals, you need to decide at which part of this triangle would you want to be in. Does this assessment excite you? Does this policy development excite you? Or is it that assurance that excites you? You could be at any one of these, the 3 points of the triangle. So you need to decide, and this may not happen early in life. It might take quite a few years. Or in the beginning, you might want to move between all of these points till you decide that, okay, this is what I really want to be in. But you have to be continually aware that this is what exists and this is what I'm doing. But yes, to begin with, you have to have a relatively good, well-grounded awareness or knowledge on all of these to be able to specialize. And yes, as you go along the way, you would need specific skills to be picked up. So your graduate degree will prepare you for an overall understanding of things. But then, if you want to be a epidemiologist, you would want to hone your epidemiology skills. If you want to be a biostatistician, that's where you want to hone your skills on. Might want to do modeling, or you want to work policy work. So that's it. Now, if you ask me, there's one very fundamental thing that I want to say. Like I tell this to all young public health graduates. Please understand, public health doesn't happen from behind air-conditioned offices. So do not expect to work out of plush air-conditioned offices right after your graduate degree. That's not from where public health happens. Public health happens at the grassroots level on the ground. And yes, you might have seen some of your colleagues, some of your friends who've made the jump and started their life from air-conditioned offices. But believe me, they wouldn't climb up very high, because to create a building without your foundation, it's bound to fall. So if you start with your foundation, start from the grassroots, start from the ground, climbing up, you'll definitely be able to make to the top. But if you want to make jumps in between, all the jumps will not be even, and it wouldn't be a straight climb up. So start from, I'm sure you've gone through your MBBS degrees. So your public health starts from the sub-center. It starts from the PHCs, the CHCs, and your district hospital and the community. So you have to make efforts to start there and then gradually climb your ways up. That's what I would advise for all public health graduates. Now, the opportunities in this country is immense. India has committed to spend 2.5% of their GDP on health, which means a huge amount of money. From spending less than 1% currently to increase it more than twice is a huge amount of investment, which needs a huge amount of people. We have created, the National Health Policy has mandated for public health cadres within the health workforce. So there is an immense opportunity for public health workers, public health experts. So the situation could never be any better for public health professionals in the country today in India. And of course, the opportunities all over the world do exist, but I would focus on the country to begin with. I would stop there. So if there are any specific questions, we would take them. There are some, apart from all the
Shomik, I'm not able to hear you. Is it only me or?
Yeah, I think I think he's lost his connectivity. Let me just get in touch with him.
Yeah.
Yeah. Meanwhile, Preeti, you can address some of these things. Like there are some very important questions. Like one of the participants is asking whether there are any internship opportunities or any short-term assignment you can get hands-on. So if you can address that.
Sorry, I was just
Absolutely.
logged out suddenly.
Yeah.
I just suddenly logged out.
Right.
Sorry about that. Yeah, there are some questions on the chat.
Shomik. Yeah. So, Dr. Rujita was asking about internship opportunities. So maybe you want to
Yes.
start off with answering that first.
Yeah, so we do have, so the way it works is you might want to apply to any of the faculty if you have specific interest in certain areas. So if you're interested in epidemiology or biostatistics or health technology assessment, if you know any of the faculty, you can write to the faculty directly, and the faculty will direct them to the HR. And then if there are opportunities, if the faculty has projects, they would take them on as interns. They might not be paid internships. It's much easier for us to do non-paid internships than paid ones, because if they are not funded, then we can't pay. And you could also go up on the PHFI or individual IRPH Delhi websites and then apply. There would be an email address given there. You can write there and they would be then directed to the respective faculties. Yes, so we do take interns, and sometimes they are on existing projects. Sometimes we can also create opportunities for internships for you. So we would be happy to take students as enter.
Yeah, I think
Besides,
that
if I can
answers
just
Dr.
add, yeah, if I can just add to what Shaumik just said, in addition to internships, we also, as I said earlier, we conduct a lot of projects, right? So Shaumik may have, let's say, 2 or 3 projects with him where he is the principal investigator. I have some, and then there are other colleagues as well. And we may have opportunities to have, some people from your group on board as, let's say, part of the research team. So, I mean, of course, it's difficult to say right now what opportunity and exactly what kind of work will come along, because the topics on which we work are varied and wide. But that opportunity also exists at IIPH. Yeah. Sorry, Dr. Rajat, please go ahead.
Yeah, that answers Dr. Deepika's question. There is another one by Sayan Biswas, and the question is that those who are in clinical subjects, if they are doing residency in clinical subjects, whether these courses will help them and what way, and if they have any job opportunities. That's a question that is asked. So if that can be addressed.
So for people who are doing their clinical subject, let's say there's a pediatrician or a gynecologist, nothing stops them from doing research in those fields, as well as other fields. But then, I would presume a pediatrician would want to work in the area of, let's say, child health or immunization, or a gynecologist would want to work in the area of maternal health, for example, or reproductive, health, family planning, etc. So there is a lot of scope in those areas as well. There are organizations, there are CSR organizations, there are other, development agencies, UN, WHO, which are supporting these kind of projects specifically. And in fact, having a gynecologist on board or having a pediatrician on board is more helpful. Of course, having a public health professional on board is equally helpful, but then, their clinical expertise and the experience they bring with them can definitely be put to good use.
I think one more question address. Like many of the postgraduates are looking for, like, the dream of the job in WHO and UNICEF and international agencies like that. So how to reach there? That is their question.
Multiple ways in
That's
which
a difficult question
many
to
of
answer.
them really they have that dream.
So
Yeah,
it's better
Shaumik,
to
go
go
ahead.
up to WHO and UNICEF websites for their job offers. It will be unfair for us here to say that how can you get a UNICEF job? That will be really difficult. But yeah, so as I think what Preeti was trying to say is there are multiple ways to it. But the best way to look at them is go up to on their websites, and they have their, I think, the job portals which keep on advertising. And like now, I've never got a WHO job, so I really can't tell you how to crack that. So, but yes, we do have projects from WHO and UNICEF, and we have had research assistants and associates who have worked on those projects and have then later on gone on to work with WHO and UNICEF. Preeti, if you could add anything onto that.
Yeah, Shaumik, I think you've said it. The best way to do it would be to go to the WHO portal or UNICEF portal. Also, in these circles, a lot of if you know someone who's working with UNICEF, or you know someone who has worked with someone in UNICEF or WHO, that also tends to work. I mean, this is on the side, but that does tend to work. Additionally, what you could also do is nowadays, social media, I think platforms like LinkedIn and Facebook and Instagram are very helpful. So unfortunately or coincidentally or whatever, we as medical professionals are, I don't know how tech savvy or LinkedIn savvy the younger lot is. But if you have your LinkedIn profile or you have your Facebook profile, I would suggest you also let people know that you are available after you've completed. If you're, let's say, in your final year and you're passing out this May or June, you can tell people that you are available and this are the areas of interest and this is what you would like to work on. Don't say I want to work with UNICEF, but you say I would like to work in the area of child health, or I have my dissertation. You have your dissertation, your thesis that you've been working on. So you can probably put out that topic and say, this has been my area of specialization or of my thesis topic, etc., etc. And then, there are people who can contact you as well. So it works both ways. That's why I said there are multiple ways in which you can do this. And another thing is, don't be under the impression that just because you have a WHO job or a UNICEF job, you'll be posted in Delhi or you'll be posted in the best office. Like Shaumik's first opening statement was, these are not air-conditioned jobs. We don't do white-collar jobs. We're not corporates. So be open to going to the field. My first job before I came to PHFI was with UNICEF, but I was posted in Bihar. I came from Maharashtra, I was from Mumbai, and I was asked to go to Bihar. And that was not even in Patna, that was in another town of Bihar, which I had never even heard of, right? But the work that I did there, or whatever learnings, the experiences that I had over the 15 months that I worked in that field, I have not got that experience ever afterwards. I've done a lot of projects even after that, but that experience was immense, it was unparalleled. And that happened at the beginning of my public health career, soon after I completed my MD. So I think these are, I mean, be open. What I'm trying to say is, even if it's WHO or UNICEF, your CV will always say you work for WHO or UNICEF, but be open to go even to the remotest of places and and be open to going to the field and getting your hands dirty by actually doing what can be done on the ground. Thank you.
I think it's very important, Preeti, what message that you have given. They can also look, there are some past students who are already working with UNICEF and WHO, and our current students can get in touch with them to find out what kind of skills are required and how they can acquire those skills, especially the analysis skills and writing. Preeti, I have one question. I think it is nothing, it has not come from the students, but I would like to ask you, in today's world of artificial intelligence and so much of new technology that is coming, that is coming in, how do you see the public health jobs in next 5 years, maybe because see, some of our students are very tech savvy and they are really keen on working on these new technologies, learning, and I do find some of candidates really doing well in that field. So, do you have anything to tell them if they are working in these fields of AIs and all?
Ma'am, the thing is that AI is inevitable now in the coming years.
Yes.
You know, in terms of health, in the health space also, AI has come in already, and in the coming years, it's only going to expand. And we will not be able to avoid, you know, facing it or interacting with it or using AI in our work as well. As of now, we don't use, as in we at PHFI at least, we have not been using AI as much because we still, you know, we've been using the very conventional methods of teaching or training or research. And I think that also has its own, you know, charm. You cannot take away skills that I would bring in as somebody who knows my statistics or epidemiology, and we can't say AI is doing a much better job than, say, a Dr. Preeti or a Dr. XYZ. So that acumen or that experience or that expertise will always come in from us. But where AI can definitely help is to sort of complement our skills and our knowledge. And digital health, certain areas of public health where AI or where digital technology can definitely be of help. So maybe moving forward, what these students who are currently doing their MD might want to also, you know, add as a skill, you know, is how to use it in a beneficial way, rather than, you know, trying to say, I will replace, you know, a human professional with an AI, you know, input or something like that. Shaumik, would you want to add to this?
Mr. Shaumik has another meeting, so he just texted me. He has to shift to that meeting now, so he won't be available. Yeah.
Okay. All right. Yeah. So I think AI, as I said, yeah, we will be using AI. We as in, you know, generally, I think everybody's using AI right now. So I'm sure it's not very long before we have a lot of AI induced interventions, which will, or AI supported interventions that we will have in public health as well. अभी time है उस चीज के लिए, but I think we'll have to learn how to use it to our advantage rather than say AI will replace us. So, but at the end of the day, our skills, our knowledge, our experience is something which, according to me, I don't know. I hope I'm not proved wrong, but I feel that, you know, that cannot be replaced. So don't assume that, you know, nahi aata to chal jayega, AI will do the work for us, or AI will tell us what a p-value is, or AI will tell us what a CI is, or a significant result is. That is something which we will at the end of the day have to interpret. So yeah.
Any more questions? Participant can even ask directly. This,
I don't think there are any more questions now.
this Dr. Varalakshmi is asking somebody working in mental health. So she can get in touch. Dr. Varalakshmi, I think Kanika madam has given an email address. So you can get in touch and find out. She's interested in working probably in mental
Okay.
health.
Okay. Okay.
Any more questions? Yeah, I really thank all the participants. I think they have joined from various parts of not only Maharashtra but even other states. So it was really nice having so many people in this discussion. I wish it would be a little more interactive. Some people have questions, but can really ask questions directly. You know, they don't have to be
Excuse
shy
me.
for that. Yeah.
Hello, good afternoon, ma'am.
Yeah.
I'm actually myself, Dr. Gajan Kurde from GMC Sambhajinagar. I would ask one question: whether this concept of I'm PG from community medicine,
Yeah.
whether do you have any
Yes.
opportunity for this care coordination concept?
Care coordination in terms of what?
In terms of integration of this multi-sectoral coordination. For example, if you want to give in a under one roof, if you want to give all screening and preventing, and even after rehabilitative services also.
No, so are you talking about us giving services?
Yes, are you providing such type of any course?
As of now, we do not. So, Dr. Gajanan, we are an academic institute. We do not provide those services in the field. We are actually training other public health professionals, young professionals like you, to go and learn and, sort of take on these jobs outside. So if you ask, if I hope I've understood your question correctly. If I have, let me tell you that we do not provide those services. Okay, but we actually train individuals to equip them with the skills to go and sort of provide those services later on. So after their graduation, post graduation.
Ma'am, one more question, please.
Yeah.
Any course regarding clinical epidemiology?
We have a course regarding epidemiology. If you're specifically looking for clinical epidemiology, there is no separate course on clinical. No, we do not have a separate course as yet on clinical epidemiology, but we do have an e-learning course on epidemiology.
Here, and there is a question about how to get into health policy and health program related jobs. What are the way to get into those jobs?
Okay, so I think the best way to do this would be to get onto the Ministry of Health portals where these jobs are announced. A lot of times these jobs are also announced through newspapers, and so if you're on the lookout, and as I said, nowadays everybody's on LinkedIn. Even Ministry of Health, there are lots of people from the ministry who are part of LinkedIn. So just be on the lookout for when these people put out a vacancy and they say that we have these positions open, and you can get into these jobs at the state level or even at the central level. Or like as I said earlier, also if you know somebody, then the path becomes a little shorter and becomes very much more easier that ways. But generally, it is interview based hiring, and the portal and the website, and as I said, social media platforms. Please keep looking at them to look out for vacancies.
There is a question as to whether we can pursue the course while doing MD community medicine. Now,
Yes.
AFIH
Yes.
is a different thing. AFIH is occupational and it is conducted by different institutes altogether. Let us
Right.
talk about the courses that are being offered by CHFY here. So whether they can they do these courses while pursuing their MD community medicine?
Right. So I was talking about our e-learning courses during my presentation. Those courses can easily be done while you are doing your MD because they are completely online courses. You enroll online, you learn online, your assessments are done online, your certificate you get online. So everything is online. You don't have to come down to our institute at all. Okay, so it is very easy, and it's, as I said, it is self-paced. They're flexible in terms of timing. So let's say you are available only on Saturdays and Sundays to do it. You can do it on Saturdays and Sundays. We have our portals open to give to apply for the to give out the assessments for a good week or 10 days time. So if you say, oh, I don't have time between Monday and Friday because I have my own MD work to do or my studies to do, I will do this on Saturday and Sunday. That also is available for you. So those opportunities are available.
Okay, MC Manipal also is there.
Right.
Any questions? Dr. Kasbe, sir, you are saying something?
Hey, madam, काही प्रश्न
not
नाही. I
audible.
just wanted to know, is there any age bar for joining the course or anything of that sort?
Nice, sir. No, there is no age bar for joining the course. In fact, some of our students have been even, we've had students, very few, but we've had students who are 50 plus as well. It's just that, people older age group probably don't see this as a field which they would like to do something about later on, when they're in their 50s or maybe early 60s. But we do have people who are in their 30s and 40s and early 50s also. A larger lot of is in their 20s, but there is no age bar. To answer your question, there is no age bar.
Achha, but with the changing trend, I think this have also may change. But anyway, I just wanted that question to be answered.
As of now, we don't have an age bar. So as I told you, we've had, if you remember, I talked about our PGT-PHM program. So we've had medical officers coming in. So quite senior people have also enrolled into the program.
Okay, thank you. Thank you.
Yeah, thank you.
Okay, I think not more questions are coming. Okay, for e-learning, we do have people joining above 50, 60. Okay, that's Kanika. Okay, that's nice. And I think it's a good trend with the increased longevity and people remaining healthy and vibrant and eager to learn new things. So it's a good trend.
Right.
Yeah. So I think we have covered most of the things, and participants can always refer to the websites and get in touch on emails. So the whole purpose of this webinar was that there are so many opportunities available, so we want to open some vistas. So we thought that since Public Health Foundation of India is such a reputed institute, and like Dr. Dhodpe sir, Dr. Digandhi, and like Mr. Soumik, and even Kanika is there in touch with us for a long time. We thought that we just link the participants, the residents who are looking for job opportunities in public health field, and Public Health Foundation, which is offering good quality courses which are recognized internationally. So we thought that if we bring these two together, probably it will help our youngsters. Now I won't say only youngsters, even the senior participants. So that was the whole purpose of this webinar. I thank Public Health Foundation of India and Preeti and Kanika and Shaunik for giving their valuable time. And also I thank participants from probably all over the country. I
Right.
don't have individual names of the institutes of the participants. Always email to Kanika and remain in touch. So it was really nice that they have responded and they are here today in this webinar. So thank you so much. And
Thank
over
you.
to
Thank you, ma'am,
Kanika
for
and
giving
Preeti.
us this opportunity. And this is my first webinar with the Mumbai, groups, and also, of course, the other Maharashtra and other, I think we have people from Manipal, Tamil Nadu as well. And Goa. Thank you very much for giving us this opportunity. And as Dr. Rujita said, if there's anything that you would like to, you want to interact with us further, or there's any opportunity for internships or research, and you would think we can collaborate, I'd be more than happy to be in touch with you. Thank you so much.
Thank you so much, Dr. Preeti. Thank you so much, Dr. Rujita, for giving us this opportunity to host the webinar in collaboration with TN Medical College. We express our sincere gratitude for that. And we express our gratitude to all the participants who have joined this webinar. Thank you so much.
So I think we'll stop recording now and we'll end the meeting,
Yes.
WebEx meeting. Yeah. Thank you, Dr. Rujita. Thank you once again. Bye-bye.
Yeah.
Have a nice
Thank you.
weekend, everyone.
Bye.
I think there's one quick message on the chat box. I will maybe speak to you separately, sir, if that's okay. I can maybe we can get in touch over the phone or over email. Thank you so much.